Hello, I'm Dr. Mad. How are you? I understand. Alright, let's go ahead and verify your chart. I want to make sure that I have the right information here. And then we'll go ahead and talk about what's going on with you. Can you please verify your date of birth? Okay. And your full name? Okay, perfect. Looks like I have the right chart. Now, is your address still the same? Okay. And your phone number and insurance? Great. Okay. Go ahead and tell me what's going on. Okay. And when did that start? Okay, so you're having some short memory loss. And also, you noticed some tingling sensations? Okay. I'm going to ask you a few questions. They are related to your neurological exam. Have you experienced any persistent or sudden onset of headaches? Sometimes. Okay. And is that a headache that changed or is different or it's just new? Okay. All right. Any weakness or loss of muscle strength? Okay. And new memory loss, short term. Okay. Have you noticed any impaired mental ability? Hard to tell. Okay. I'll definitely ask some questions during the exam and we'll figure this out. Any lack of coordination? Okay. And are you taking any new meds? Okay. Alright. I'm gonna have you relax. I will go ahead and examine you. And you also said you're experiencing some tingling sensations, right? Okay. Is that in your fingers or toes? Fingers and toes. Okay. Okay, have you noticed any changes in your body temperature? Okay. I'm going to put this under your tongue. Thank you. Perfect. Okay. Temperature is 99.1. Alright, let's go ahead and take your blood pressure. Which arm would you prefer? This one? Okay. Sounds good. Okay, let's go ahead and wrap this one up here. Perfect. Okay. I'm gonna have you uncross your legs for me, please. Okay. Let's go ahead and fix these. that too much? No. Okay, good. Blood pressure is a little bit on the low side. So let's go ahead and figure why. Alright, I'm gonna go ahead and listen to your heart, okay? So I'm gonna have you relax. Is it okay if I slide the stethoscope under your shirt? Okay, perfect. And breathe normal for me, please. Good. 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 Okay. I can hear only S1 and S2, no S3, no S4. And I'm going to go ahead and listen with the bell, which is the other side of the diaphragm. Alright. I'm listening for any murmurs just to rule out any cardiac problems. Good. Okay, no murmurs are heard. I'm gonna go ahead and listen to your lungs. Can you please take a deep breath in and breathe out? Good. And on the other side, take a deep breath in and breathe out. Okay, and on the side of your chest, take a deep breath in and breathe out. Good. And on the other side, take a deep breath in and breathe out. Okay. I'm gonna go ahead and take your pulse. Alright, so what I'm gonna do is I'll put 2 fingers on your neck and I will be counting for about 20 seconds here. Okay, alright, and on the other side, I'm just gonna put 2 fingers on your, and I will use my watch here to calculate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, your heart rate is a little bit elevated. Are you feeling anxious at all? A little bit. I'm so sorry to hear that. Alright, I'm going to be very gentle just to make sure that we are decreasing your anxiety and your heart rate. Okay. Vital size within normal limits. Okay. I would like to start with your nose. Now, have you noticed any abnormalities with your smell? No. Okay, so what I'm gonna do is first I will cover one nostril and I'll ask you to take a deep breath in through your nose. So go ahead and breathe in and out through your nose. Okay, good. Right, and on the other side, take a deep breath in through your nose and out through your nose. Okay. No obstruction, so both layers are patent. I would like to take a look inside your nose now. Is that okay? Alright, I'm gonna ask you to look up for me. I'm examining your mucosa. And it looks like there's a little bit of inflammation. Alright. And I think on both sides, definitely. Okay. Alright, I'm gonna go ahead and test your smell first. I'm gonna need you to take a deep breath in through your nose. Good. So are you able to distinguish the smell? Peppermint. Very good. Alright, let's go ahead and try one more. not smell like charcoal. Okay. Alright, now I have one more. Go ahead and take a deep breath in and breathe out. Peppermint. Perfect. Alright, and there are no changes in your smell. Okay. Let's go ahead and check your taste. Alright, first I want to examine the anatomical part of your tongue and your mouth. So what I'm going to ask you to do first, I'm going to examine the anatomical part of your tongue and your mouth. What I'm going to do is I will use this tongue depressor to gently press down on your tongue, and then I'm going to go ahead and just take a look with my light here, okay? Go ahead and give me a big ah. Okay. Tongue is symmetric. I'm not noticing any abnormalities. Alright, I'm going to go ahead and do a sensation inside your mouth, okay? Alright. So what I'm gonna do is I will touch you with a very soft texture inside your cheeks or your gums or your tongue or your upper or lower palate. So I'm gonna go ahead and ask you to give me a big ah. Okay, and go ahead and tell me if you feel sharp or dull. So one is going to feel sharp. This is what sharp will feel like, and this is what dull will feel like. Okay, did you feel that? Perfect. Alright, so go ahead and open your mouth and tell me if you feel sharp or dull. Sharp. Dull. Okay. What about now? Dull. And now. Dull. Okay, very good. Alright. Now I'm going to spray a taste in your mouth. I'm gonna need you to identify it, okay? It's a very common substance. I just need you to tell me what it tastes like. Okay, go ahead and give me a big ah. Good. Okay. What does that taste like? Strawberries. Very good. Right, let's go ahead and do one more. Okay, give me a big ah, please. What does that taste like? Roses. Good. Okay, I'm going to go ahead and do a vision exam, okay? Can you please look right here at my nose? I'm going to flash a light in your eyes. Good, good. And again, look straight in my nose, okay? Good. Keep looking at my nose. Good. Good. Okay. Now I'm going to ask you to tell me when you see the light in your field of vision. I'm going to cover one eye for you, though. Okay. Now. 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 Good. And on the other side. Now. 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 Perfect. Okay. Can you please tell me which fingers are moving, my right or my left? So this is right, left. Good. 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 Perfect. Good. 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 gonna go ahead and examine your retina and your optic nerve. Okay, I'm gonna ask you to look behind me, straight at the wall, okay? I'm going to come very close to your eye. Okay, can you please look behind me, straight at the wall? Excellent. And now look up. Good. And now look down. Okay. Perfect. Alright, let's go ahead and check your other eye now. There is some redness behind the retina on your left eye. Okay, perfect. Keep looking behind me, please. Good. And that's perfect. Okay, look up. Good. Okay. Alright, and now I'm going to go ahead and place one drop in your eye. This is going to help to dilate the pupil, and I'm going to be able to identify if you have any neurological ocular problems. Alright, go ahead and look up for me. I'm going to place one drop of this medicine in. Okay, and on the other side. Okay, perfect. Alright, now go ahead and blink a few times. Okay, how's the blinking? Great. Alright, now I'm gonna ask you to do not move your head, okay? Go ahead and tell me when you see these balls in your field of vision. Now. Good. Now. Perfect. What about now? Now. Okay, wonderful. Now I'm gonna ask you to follow the green ball with your eyes only. Do not move your head. Okay, keep on looking at the blue, at the green. Okay, perfect. Follow the green ball only. Good. Right now we're testing dimensions and also how your ocular movement is acting. And I'm not seeing any deviations from the normal so far. So you're doing great. Keep on following the green ball. Okay, that was a little bit distracting, but it does have to be kind of fast. Good. Now go ahead and look at the yellow ball. Okay, follow the yellow ball only. Do not look at the green. Do not look at the green. Good. Okay. Alright. You passed the test. It was a very difficult one, but you did pass it. Alright, let's go ahead and check your vision now with the Snellen chart. So I'm gonna ask you to cover one eye. Very good, thank you. And can you please read this row, or is it too much? Here, right here. Okay, so you do have trouble seeing. I see. Alright, let's go ahead and cover the other eye now. And can you please tell me what letters you see right here? Right here. X, X, O. Perfect. What number do you see right here? Good. And what number do you see right here? Perfect. Can you read these two numbers? Can you read these three numbers? What about these ones? Okay. Alright, that looks good. Now, let's go ahead and check your ears. And have you noticed anything abnormal? Okay, no worries. Let's go ahead and take a look. Alright, can you please look that way? go ahead and look that way.
And the tympanic membrane is puckering. I'm not noticing any inflammation. The canal is clean, normal color.
Okay, very good. And I would like to check your hearing now. You did mention that no, there are no problems with the ear. Okay, no worries. Let's go ahead and use the tuning fork to determine if you have some fluid buildup. Okay, can you please tell me when you don't hear the sound anymore? No. Okay. And can you please tell me when you don't hear the sound anymore? Go ahead and tell me when you don't hear it. Now. Okay. Now what I'm going to do is I'll put it in 2 positions. This is called the ring test. And I'm going to ask you to tell me which position here is louder for you. Okay. Alright, so this is position number 1. Good. And this is position number 2. Which one you heard louder? Number 2. Okay. And I'm going to switch it now. This is position number 1. Okay. And this is position number 2. Which one here is louder for you? Number 1. Okay. Very good. Now I'm going to get another tuning fork. 1 second. Okay. So I have 2 different frequencies. Now I need you to tell me if you hear a high pitch or a low pitch, okay?
High pitch or low pitch?
Good. Okay. High pitch or low pitch?
Okay.
And let's go ahead and check your other ear. High pitch or low pitch? Okay. And now I'm using a different tuning fork. Go ahead and tell me which high pitch, low pitch.
Okay.
Good. Alright, we're going to test you now for any weakness or muscle strength abnormalities. What I'm going to do is I'll press down on your shoulders, okay? And I need you to shrug them at the same time. Good. Perfect. Alright, now I need you to puff your cheeks. Keep them puffed for me, please. I'm going to try to unpuff them. Don't let me do that. Okay, perfect. What I'm going to do now is I will move your jaw side to side, okay? And I need you to resist that. Good. 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 Perfect. Alright, now I'm going to need you to turn your head side to side. And as I'm pushing you, I need you to resist that, okay? Okay, very good. Alright. Now I'm going to go ahead and check your facial sensation. So what I'm going to do is I will touch you with a sharp or a dull object on your face. I need you to tell me if you feel sharp or dull, okay? I'm going to show you right here on your chest what I mean by sharp. Good. And this is what dull is going to feel like. Okay, perfect. Go ahead and close your eyes and tell me if you feel sharp or dull. Good. Sharp or dull? Good. Sharp or dull? Okay, sharp or dull? Good. Sharp or dull? about now? Alright, and now? And now. Okay, and now. Perfect. Okay. We finalized today's cranial nerve examination. Do you have any questions for me? Okay. Well, if you don't have any questions, then I think we're done for today. I'm going to let you get dressed and we'll meet in the waiting room again. Okay? Alright. See you soon.